Even for the AP radiograph of the single hip, the hip is placed in such a position that the limbs are internally rotated. Then the anterior superior iliac spines are equidistant from the cassette, and the cassette is kept some 5 centimeter above the level of the iliac crest. And also we have to cover the proximal 1/3 of the femur, and if in case there is a prosthesis, entire level of the prosthesis has to be covered, so the placing of cassette becomes very important. Now centering here is done by at a point which is, or we draw a line first from the anterior superior iliac spine to the pubic symphysis. From there, a line is drawn perpendicular to the femoral pulse that we feel here, and then a distance is measured where we get 2.5 centimeter away from this line joining anterior superior iliac spine and the pubic symphysis, perpendicular to the femoral pulse is where the centering is. So this is how the centering is done. First we measure we draw a line from the pubic symphysis to anterior superior iliac spine, measure 2.5 centimeter away from it, which is perpendicular to the femoral pulse that is felt, and the centering is done there. We get an image like this, which will show the hip joint, the acetabular margins, the neck of the femur, the lesser trochanter and the greater trochanter. And to look at the greater trochanter better, we have to internal rotate the hip. More internal rotation has to be done. That's when the trochanter will come in profile. That's when we can see some avulsion fractures can be clearly seen in AP radiograph of the single hip.